You exercise 3 or 4 times a week. You watch what you eat. Your weight is reasonable. You don't smoke. You barely drink. And your last checkup showed everything looks pretty good, except for one thing. Your blood pressure keeps coming back high. And you're sitting there thinking, what am I doing wrong? Because everything the health magazines tell you to do, you're doing it. And it's still not enough. Here's the thing that almost nobody explains to patients over 60. Being healthy doesn't protect you from high blood pressure the way it protects younger people. There is a biological reason, a real, scientifically documented reason, why your arteries behave differently after 60, even if you've taken care of yourself your entire life. And understanding that reason completely changes how you approach this problem. I'm Dr. James, and this channel is dedicated to bringing you the latest research on senior health. Explained clearly, without the jargon, without the fear, just the real information you need to make smart decisions about your body. If you're not subscribed yet, I'd encourage you to hit that subscribe button right now so you don't miss videos like this one. We put out new content every week specifically for people in their 60s, 70s, and beyond. Now let's get into what's actually happening inside your blood vessels. The core reason healthy older adults still develop high blood pressure comes down to one unavoidable biological process: arterial stiffening. Your arteries are not rigid pipes, or at least they shouldn't be. In a younger person, the large arteries, especially the aorta, which is the main artery leading out of your heart, are flexible and elastic. Every time your heart beats and sends a pulse of blood through your system, those elastic walls stretch to absorb the pressure and then they spring back. That stretching and rebounding is what keeps your blood pressure numbers in a healthy range. But here's what happens as the decades pass. The structural proteins inside your artery walls begin to change. Collagen, the stiff, fibrous protein, starts to accumulate and cross-link in ways that make the tissue less flexible. Meanwhile, elastin, the protein responsible for that springy, elastic quality, begins to break down and isn't replaced at the same rate. The result is that your large arteries become progressively less able to absorb the force of each heartbeat. Instead of stretching, they resist. And when the walls resist, the pressure inside the vessel has nowhere to go but up. Medical researchers call this arterial stiffness, and it's been studied extensively. A landmark analysis published in the journal Hypertension tracked thousands of adults across multiple decades and found that arterial stiffness, specifically measured by something called pulse wave velocity, is one of the strongest independent predictors of cardiovascular events in older adults, separate from any other risk factor. That means even in someone who eats well, exercises, and maintains a healthy weight, arterial stiffness alone can drive blood pressure into dangerous territory. Here's what makes this particularly striking. If you look at populations of older adults who have excellent lifestyle habits, regular exercise, plant-rich diets, low stress, healthy sleep, their systolic blood pressure, that top number still tends to rise with age. The diastolic number, that bottom number, often stays flat or even decreases slightly after age 60. This pattern creates what doctors call isolated systolic hypertension, and it's the most common form of high blood pressure in adults over 60. Not the salt and stress kind that younger people get. A fundamentally different kind, driven by the physics of stiff arteries. Now let me give you a simple analogy because I think this helps it click. Imagine squeezing a balloon versus squeezing a tennis ball. When you squeeze a flexible balloon filled with water, the material stretches and accommodates the pressure. When you try to do the same thing with a rigid tennis ball, all that force meets immediate resistance. Your arteries after 60 are shifting more toward tennis ball behavior, and your heart has to generate more pressure to push blood through a stiffer system. No amount of healthy eating reverses the fundamental physics of that change. But there is a great deal you can do to slow it and manage it, and I'll get to that specifically in a few minutes. Before I do, I want to address one question I know you're probably asking. If this is a normal part of aging, does it still matter? Is high blood pressure in a healthy 70-year-old actually dangerous? The answer, based on the evidence, is yes. And here's why. The SPRINT trial, which stands for Systolic Blood Pressure Intervention Trial, enrolled over 9,000 adults at high cardiovascular risk and compared two groups, one with a blood pressure target below 140 systolic and one with a target below 120. The group with tighter blood pressure control had a 25% lower risk of cardiovascular events and a 27% lower risk of death. The benefits were seen even in participants who were otherwise in good health. The trial was actually stopped early because the evidence for the lower blood pressure target was so compelling. What that tells us is that even when high blood pressure is caused by the normal aging process in a generally healthy person, the downstream damage to the heart, kidneys, and brain is very real. Stiff arteries don't just raise the pressure reading, they send pressure waves surging deeper into smaller vessels that aren't built to handle that force. Over years, those microvascular hammering effects damage the kidneys, contribute to cognitive decline, and increase heart failure risk. This is not a minor inconvenience. It's a process worth taking seriously and addressing carefully. But here's what most doctors don't take enough time to explain in a 15-minute appointment. Arterial stiffness is only one part of the story. There are several other mechanisms that pile on top of it in older adults, and each one matters. The first is a change in kidney function. Your kidneys are the primary regulators of sodium and fluid balance in your body. When you're young and healthy, your kidneys very efficiently excrete excess sodium when you eat too much of it. But kidney function declines gradually with age, even in people who have never had kidney disease. By your 60s, the average person has lost somewhere between 30 and 50% of their peak filtering capacity. This makes your kidneys less efficient at clearing sodium, which means more sodium stays in your bloodstream, drawing water along with it, increasing blood volume, and pushing pressure higher. This is why sodium sensitivity increases so dramatically with age. A sodium intake that was completely harmless at 40 can meaningfully raise blood pressure at 65. The second mechanism is something called baroreceptor insensitivity. Baroreceptors are pressure-sensing nerve endings located in major arteries near your heart and neck. Their job is to constantly monitor blood pressure and signal your nervous system to adjust heart rate and vessel tone when pressure goes too high or too low. When they're working properly, they act like a very precise thermostat for your blood pressure. But with age, these sensors become less responsive. They don't detect pressure changes as quickly or accurately as they once did. The result is that your cardiovascular system loses some of its ability to self-correct, making blood pressure more volatile and harder to regulate automatically. And then there's the role of chronic low-grade inflammation. This one is still an emerging area of research, but the evidence is growing strong enough that it deserves serious attention. A phenomenon that researchers call inflammaging, that's inflammation plus aging, refers to the persistent low-level inflammatory state that accumulates in older adults even without any obvious disease process. This chronic inflammation directly damages the endothelium, which is the thin inner lining of your blood vessels. Healthy endothelium produces a molecule called nitric oxide that causes blood vessels to relax and dilate. Inflammation impairs nitric oxide production, causing vessels to remain more constricted, contributing to higher pressure even at rest. A 2022 study published in the Journal of the American Heart Association found that markers of systemic inflammation were significantly associated with arterial stiffness in adults over 60, even after controlling for other cardiovascular risk factors. I want to tell you about a patient named Eleanor. She was 71 years old when she came in, deeply frustrated. She walked 5 miles every day. She cooked almost entirely from scratch. She had maintained the same weight for 20 years, but her systolic pressure was consistently running between 140 and 155. Her previous doctor had told her she needed medication, full stop, with no explanation of why her healthy lifestyle wasn't keeping her numbers down. Eleanor didn't want to refuse medication. She just wanted to understand. When we walked through the arterial stiffness process and the kidney sodium changed together, something shifted for her. She wasn't doing anything wrong. Her body was going through predictable biological changes, and now we could address those changes specifically instead of just throwing a pill at a number. So, let's talk about what actually moves the needle. Because even though you cannot reverse arterial stiffness entirely, research shows you can meaningfully slow its progression and significantly improve your blood pressure numbers by targeting the specific mechanisms driving it. The first and most well-supported intervention is aerobic exercise. And I want to be precise here, because not all exercise affects arterial stiffness equally. Resistance training, while excellent for muscle mass and bone density, has modest effects on arterial stiffness. Endurance aerobic exercise, on the other hand, has direct evidence behind it. A 2021 meta-analysis in the British Journal of Sports Medicine reviewed 14 randomized controlled trials and found that regular moderate intensity aerobic exercise reduced pulse wave velocity, the gold standard measure of arterial stiffness, by an average of about 1 meter per second, a clinically meaningful reduction. The protocol that produced the best results was at least 30 minutes of moderate aerobic activity, 5 days per week. Walking counts, swimming counts, cycling counts. The key is sustained, continuous movement that elevates your heart rate moderately for a prolonged period. Here's something that surprised even experienced cardiologists in recent research. The timing and pattern of exercise matters more than previously thought. A study from the University of Maryland published in 2023 found that splitting exercise into shorter bouts throughout the day, say 3 10-minute walks rather than one 30-minute walk, was actually as effective as one continuous session for improving endothelial function in older adults. This is important news for people who find it difficult to sustain 30 minutes at once due to joint discomfort or fatigue. Have you noticed changes in your blood pressure readings at different times of day? Comment below and let me know. Something like your morning reading versus your evening reading. This kind of data is genuinely useful, and I'd like to understand what you're experiencing. The second key intervention targets the sodium sensitivity issue I mentioned earlier. But I want to be careful here, because the guidance is more nuanced than eat less salt. The research on older adults specifically shows that it's not just about reducing total sodium intake. It's about increasing potassium intake simultaneously. Potassium and sodium work in opposition inside your kidney tubules. Higher potassium intake helps the kidneys excrete sodium more efficiently. A landmark study in the New England Journal of Medicine published in 2021 called the SSASS trial enrolled nearly 21,000 participants and found that replacing regular sodium chloride with a potassium-enriched salt substitute reduced the rate of stroke by 14% and cardiovascular death by 12% compared to people using regular salt. The effect was particularly pronounced in older adults with existing high blood pressure. The practical goal for adults over 60 is to keep daily sodium intake below 1,500 milligrams. That's about 2/3 of a teaspoon of table salt total, while aiming for at least 3,500 to 4,700 milligrams of daily potassium from food sources. Potassium-rich foods for seniors include white beans, cooked spinach, baked potato with skin, avocado, salmon, and bananas. Consistently eating these foods can make a measurable difference in blood pressure within 8 to 12 weeks. But here's what most people don't realize, and this is genuinely important. The magnesium piece is often completely overlooked. Magnesium is required for proper vascular smooth muscle relaxation. Without adequate magnesium, the muscle fibers wrapped around your blood vessels stay in a more contracted state, increasing resistance and raising blood pressure. A 2016 meta-analysis published in Hypertension, analyzing 34 clinical trials covering over 2,000 participants, found that magnesium supplementation reduced systolic pressure by an average of 2 mmHg and diastolic by 1.78 mmHg. Those numbers sound modest, but in context, they're clinically meaningful, especially stacked on top of other interventions. Now, let me also address something that many people over 60 are not being adequately counseled about, and that's sleep quality and blood pressure. This is one of those areas where recent research has changed the picture significantly. In a young, healthy adult, blood pressure naturally dips by 10 to 20% during sleep. This nighttime dipping is restorative. It allows the cardiovascular system to recover from the daytime demands. But research published in the Journal of the American College of Cardiology in 2022 found that older adults with fragmented sleep, poor sleep quality, or sleep apnea, which becomes dramatically more common after 60, lose this nighttime dip. Instead of recovering, the cardiovascular system remains under pressure through the night. These so-called non-dippers have significantly higher rates of heart attack, stroke, and kidney damage compared to age-matched adults who maintain healthy dipping patterns. If your blood pressure is elevated, particularly in the morning upon waking, and if you snore, feel unrefreshed in the morning, or your partner has noticed you stop breathing during sleep, please bring this specifically to your doctor's attention and ask to be evaluated for obstructive sleep apnea. Treating sleep apnea in older adults has been shown to reduce systolic pressure by an average of 4 to 6 millimeters of mercury, without any medication changes. Let me tell you about Frank. He was 68, a retired high school principal, healthy weight, no significant health history, but his morning blood pressure readings were consistently running around 158 over 88. His evening readings were actually quite good, around 128 over 76. That pattern is a significant clue. High morning pressure that drops as the day goes on often suggests a non-dipping pattern during sleep. After a sleep study confirmed moderate obstructive sleep apnea, Frank was fitted for a CPAP machine. After 90 days of consistent CPAP use, his morning systolic pressure had dropped to 134. His cardiologist, who had been preparing to start him on medication, decided to hold off and continue monitoring. The story doesn't always end that neatly, but the lesson is that pursuing the cause specifically, instead of just treating the number, gives you far better outcomes. Wait until you hear the one piece of this puzzle that most doctors never bring up. And it involves a process happening in your gut. Emerging research on the gut microbiome and blood pressure regulation is still early, but it's compelling enough that I want to mention it here. Your gut bacteria produce short-chain fatty acids through the fermentation of dietary fiber. These fatty acids, particularly one called butyrate, appear to interact directly with the same renin-angiotensin-aldosterone system that blood pressure medications target. A 2023 study published in Circulation Research found that older adults with reduced gut bacterial diversity had significantly higher rates of arterial stiffness and elevated blood pressure compared to age-matched adults with healthier microbiomes. The practical implication is straightforward. A diet rich in diverse fiber sources, legumes, vegetables, whole grains, fermented foods like plain yogurt and kimchi, supports the bacterial populations that seem to help regulate blood pressure through this gut cardiovascular axis. This is not a replacement for other interventions, but it adds another layer of explanation for why two people with the same lifestyle habits can have very different blood pressure outcomes as they age. Now let's get into exactly what you should do with all of this information. Here is a practical protocol built on the evidence I've described. First, get a home blood pressure monitor and measure your pressure twice daily for at least 2 weeks. Once in the morning before any food or coffee, and once in the evening before bed. Record both readings. The pattern matters as much as the numbers. As if your morning readings are significantly higher than your evening readings, raise this with your doctor and specifically ask about a sleep evaluation. Second, adjust your aerobic exercise to prioritize sustained, moderate intensity movement. Aim for 5 days per week, 30 minutes minimum per session. Walking at a brisk pace is completely sufficient. If joint pain limits sustained walking, cycling or water exercise achieves the same arterial benefit. Stay with this for a minimum of 12 weeks before evaluating whether it's moving your numbers. Third, get specific about sodium and potassium simultaneously. Use a nutrition tracking app for 2 weeks to actually measure your daily sodium intake. Most people are shocked to discover they're eating 2 to 3 times the recommended amount without realizing it, primarily from packaged foods, restaurant meals, and bread. At the same time, consciously add at least one high-potassium food to every meal. White beans in your lunch soup, half an avocado with dinner, a baked potato twice per week. Fourth, consider magnesium glycinate supplementation. Glycinate is the form with the best absorption and the least likelihood of causing digestive upset, which is the main side effect of other forms like magnesium oxide. A dose of 300 to 400 milligrams at bedtime is the evidence-supported range. Always discuss supplementation with your doctor before starting, particularly if you have kidney disease or take medications that affect kidney function, as magnesium can accumulate to harmful levels if kidney clearance is impaired. Fifth, Prioritize sleep quality as a cardiovascular intervention, not just a comfort issue. If you're sleeping fewer than 7 hours or experiencing poor quality sleep, address this aggressively. Sleep hygiene matters. A dark room, no screens for 60 minutes before bed, a consistent sleep and wake time. And if you have risk factors for sleep apnea, being male over 60, carrying extra weight around the neck, or snoring, pursue a formal evaluation rather than assuming it's just aging. Before making any changes to your current blood pressure medication regimen, please talk to your doctor first. Some blood pressure medications, particularly beta blockers and diuretics, require gradual tapering rather than abrupt discontinuation. The lifestyle changes I've described are complementary to medication, not replacements for it, unless your physician specifically determines otherwise based on your response. If you've been given a high blood pressure diagnosis or your readings are consistently above 140 over 90, and if you experience chest tightness, severe headaches, visual changes, or dizziness, please seek medical evaluation promptly. These can be signs of hypertensive urgency that need immediate attention. Here's what I want you to take away from today's video. High blood pressure in healthy people over 60 is not a personal failure. It is a consequence of real biological changes, arterial stiffening, reduced kidney sodium clearance, baroreceptor changes, and chronic inflammation that accumulate with age regardless of how well you've lived. But understanding those mechanisms gives you a targeted, evidence-based path to genuinely improving your numbers, not just managing a symptom, but addressing causes. Now I want to hear from you. Comment below with one of three things. Comment taking action if you're going to implement at least one strategy from this video. Comment your morning systolic reading, just that top number from this morning, so we can see what the community is experiencing. Or comment sharing this if you know someone over 60 dealing with unexplained high blood pressure who needs to see this. Your comments genuinely help this video reach more people who need this information, and I read them. Thousands of seniors are asking the same questions you're asking, and the more this community grows, the more people we help together. If you haven't subscribed yet, please do it now. And next week, we're covering one specific mineral deficiency that's been linked to both high blood pressure and nighttime leg cramps in adults over 60. And the connection might surprise you. Until then, I'm Dr. James. Stay informed, stay proactive, and take good care of yourself.